iHealth TV, preventing needless blindness.
The time is 10 o'clock. Here is iHealth News at 10. First, the top headlines. RCBO's landmark event for World Sight Day promotes eye health awareness. Pediatric Eye Society urges eye health education in antenatal classes nationwide. APP 13007 eye drops show significant pain relief after cataract surgery in phase 3 trial. Study finds black patients less likely to receive genetic testing for retinal diseases. Breakthrough study shows success of ICEPS in treating limbal stem cell deficiency. Stanford NYU researchers highlight limited use of AI in diabetic retinopathy screenings. Now the news in details. To mark World Sight Day and International White Cane and Safety Day, the Resource Center for the Blind, RCB, organized a landmark event highlighting its dedication to eye health and support for the visually impaired. The event drew over 200 attendees, including law enforcement officers, stressing the significance of eye health awareness and the role of the white cane in promoting independence for visually impaired individuals. With dual themes, eye care everywhere for World Sight Day, and together we see building a community of support for the visually impaired for White Cane Day. The event demonstrated RCB's commitment to accessible eye care and community support for individuals with vision loss. RCB Executive Director Timitayo Ainila opened with a powerful appeal for early intervention in eye health and emphasized the crucial role of law enforcement in promoting accessibility. The event provided free screening, health checks, and specialized training for law enforcement officers from the Vehicle Inspection Officer VIO, Lagos State Traffic Management Authority LASMA, and the Federal Road Safety Car, equipping them with skills to assist visually impaired people more effectively. Dr. Olubunmi Akinriade, an ophthalmologist from Lagos General Hospital, led an engaging session on preventing vision loss and maintaining eye health, underscoring the importance of regular eye exams. Reinforcing this, the Lagos State Chapter Chairman of the National Association of the Blind spoke on the significance of the white, urging law enforcement to recognize its role in fostering independence and safe mobility. The event provided tangible support. Over 100 participants received free reading glasses, another 100 received free eye medications, and 30 individuals were scheduled for free cataract surgeries in collaboration with Eye Foundation. The Nigerian National Blindness and Visual Impairment Survey reveals that roughly 4.25 million adults over 40 experience moderate to severe visual impairment or blindness, highlighting the need for early intervention. RCB believes that with increased awareness and support from law enforcement, the safety and mobility of visually impaired Nigerians can be greatly improved. RCB's event marks a vital advancement towards accessible eye care and preventing blindness within the community, setting a new benchmark for proactive eye health and supporting for individuals with vision loss. The Nigerian Pediatric Ophthalmology has called on federal and state hospitals to include eye health education in antenatal classes to inform pregnant women about potential eye conditions their children may face. In an interview with ILTV at Olabisi Onabanjo Teaching Hospital Shagamu, the Ogun State Chairman of the Society, Dr. Bodunde Olubunmi, emphasized the importance of early education in preventing childhood blindness. Dr. Olubunmi noted that many hospitals overlook eye health education for expectant mothers, failing to discuss eye conditions that affect newborns, their causes, and the basis of preventive care. According to her, 1.2 million children worldwide suffer from blindness, but data on affected Nigerian children remains scarce due to limited record keeping. She observed that ignorance and lack of awareness among parents are significant factors in the prevalence of pediatric blindness in the country. Highlighting pediatric cataract as a common condition, Dr. Olubunmi explained that if left untreated, it could lead to severe vision loss, impacting children's education and psychological development.
The commonest cause of pediatric cataracts to me is actually trauma. post-traumatic. A lot of children are prone to developing trauma. I mentioned retinoblastoma, which is the most common intraocular disease of the eye in children. And some children are born with it. It could also be genetical, and it could also be due to genetic inheritance or as a sporadic thing in these children. Well, just as I said, we also have corneal infections, like children that are born that develop infections, ophthalmic nematorium. If it is not properly treated, it can involve the cornea and result in corneal blindness in the children if they are not properly treated. We could also have measles keratitis also that is affecting the cornea, and then vitamin A deficiency. Well, that is a spectrum of condition that will eventually may result in blindness in the child if it is not detected and treated early.
She said early healthcare education and awareness during antenatal care, immunization, and under 5 clinics are crucial in preventing pediatric blindness. She also recommended that midwives receive training to recognize symptoms of eye issues in children and educate people on seeking prompt optical care.
The essential thing is health education and increase awareness of mothers. When we talk about health education, mothers can be educated right from the antenatal care, the immunization clinics, and then the welfare clinics that they have, under 5 clinics, yes, let me put it that way. In which case, you have to tell the mothers to be interested in the eye of their children. When they see their children squeezing their eyes or moving close to the television, it may be a case of uncorrected refractive error. If they see any that the eye of the child is red, people should stop using traditional eye medicines like instilling urine, sugar water, battery water, salt water, or breast milk into the eye of these children. It causes more problems, and these are the things that precipitate childhood blindness in these children. Then they need to be educated. When they see any white speck in the eye of these children, they should bring them. The problem with children is that it's better to be diagnosed early, because there is need for the treatment to be started promptly, so that the child will not develop what we call amblyopia, because that also, at the time the child develops amblyopia, there is nothing anybody can do to bring the vision back to optimal position. If they see that in the night, maybe they take light and they notice that the eye of the child shines like that of a cat, such a child should be brought, because that could be retinoblastoma for all you care. Then everyone that gives birth to a premature baby, particularly if the baby is born before the 32nd weeks of gestation, or the birth weight of that child is less than 1.5 kg, or the child is nursed in a neonatal unit, maybe they have neonatal jaundice, they should bring the child as early as possible, so as to reduce the backlog of childhood blindness. Then that's when children are breastfeeding, they usually fixate, look at the eye of the mother. So if the mother discovers that the child is not looking at her eyes, then they should quickly bring the child, because there could be problem with the brain of the child. Let's look into the eye and see what is going on.
Dr. Olubumi concluded by urging hospitals to prioritize eye health education for pregnant women and to promptly refer children with eye symptoms to specialized clinics for examination and treatment by ophthalmologists. Up next, business, Africa, and world news. In business, Promethel Pharmaceutical has announced successful top-line results from the CPN 303 Phase 3 clinical trial, or APP13007, used to treat post-operative inflammation and pain after ocular surgery. The study released to the public was concluded in China by Formosa's licensee Grand Pharma, which holds exclusive rights to commercialize the drug in mainland China, Hong Kong, following a 2021 agreement. APP13007 is already approved and available in the United States, where Inovia holds commercial rights, and in Canada through Apotek Inc. The CPN 303 trial, a randomized, double-blind study, involved 255 patients in a 2-to-1 treatment to placebo ratio, assessing APP13007's effectiveness in reducing inflammation and pain after cataract surgery. The primary endpoints were sustained resolution of ocular inflammation and pain, consistent with earlier U.S. studies CPN 301 and CPN 302 completed in 2022. Results demonstrated that twice daily APP13007 eye drop regimen for 14 days led to rapid, statistically significant improvement, with 91.20% of patients pain-free by post-op day 4, maintaining this throughout day 15, compared to 55.3% on placebo. Formasa CEO Eric Cole expressed satisfaction with the study's success and alignment with US results, noting that the company looks forward to supporting Grand Pharma's commercial launch of APP13007 in China. Now in Africa, a new study published on JAMA Ophthalmology has revealed that Black patients with inherited retinal diseases (IRDs) are tested for genetic markers at a lower rate compared to non-Hispanic white patients. The research led by Dr. Vergai from the University of Michigan Medical School, which was made public, utilized patients' data from the University of Michigan and Blueprints Genetics to analyze the effectiveness of wide panel genetic testing in both groups. The study included 572 UM patients, of which 9.4% were Black and 90.6% were white. The Blueprint Genetic (BG) database contributed data from 320 Black and 2,931 white patients. The findings highlighted a clear disparity in UM's datasets. Black patients had significantly low odds of receiving a positive genetic test result. A similar pattern appeared in the BG data, where 44.4% of Black patients and 57.7% of white patients received positive or likely positive results. The study authors emphasized the implications of these findings for equitable treatment access. According to the study, patients without a known genetic diagnosis have fewer opportunities to access novel therapies, and this discrepancy in genetic testing influences equity in IRD's clinical trial. Finally, in our health news, world news. Researchers from Osaka University in Japan have made significant strides in treating limbal stem cell deficiency (LSCD) using induced stem cell deprived corneal sheaths (ICEPS). LSCD is an eye condition where the loss of limbal stem cells responsible for maintaining the corneal's transparency leads to severe vision impairment due to fibrotic tissue formation over the cornea. In their pioneering study, published in The Lancet and released to the media, the researchers concluded the first human trial of this treatment approach. They transplanted ICEPS onto the eyes of 4 LSCD patients after removing the damaged fibrotic tissues. These methods represent a potential breakthrough in regenerative eye medicine by providing a more accessible and less risky alternative to traditional grafts, which often involves tissues from a patient's healthy eye or donor, posing risk or rejection or compromising the healthy eye. The key findings of the research published include all patients experience significant improvement in vision, with 3 out of 4 showing progression to less severe disease stages. No serious adverse events were reported, and minor complications were manageable. Also, the benefits were more pronounced in patients who received an immunosuppressive drug, hinting at the potential for subclinical immunological rejection in those who did not. This technique could reduce the need for HLA matching and long-term immunosuppression, as the ICEPS were cultivated to minimize immunogenicity while replicating the natural development of corneal cells. A group of ophthalmological researchers from Stanford University, in collaboration with colleagues from New York University School of Medicine, has discovered that despite the potential of artificial intelligence (AI) in detecting diabetic retinopathy, very few patients are benefiting from AI-assisted screening tests. This comes despite the high risk of vision loss associated with the diabetes. Published in the JAMA Ophthalmology Journal, the study analyzed data from millions of diabetic patients across the US. The findings revealed that less than 2/3 of diabetic patients receive an annual eye exam, a critical measure for detecting diabetic retinopathy, a condition caused by high blood sugar damaging blood vessels in the retina. If left untreated, this could lead to vision loss. Treatments such as surgery, laser therapy, and anti-VEGF drugs can help prevent vision loss if the condition is caught early. Traditional tests typically involve dilated fundus exams, where images of the retina are inspected for signs of retinopathy. The research team aimed to assess whether AI technology was being adopted for these screenings. Using data from the Federated database, which includes information from 62 healthcare organizations, The researchers examined the records of 4,959,890 diabetic patients from 2019 to 2023. They found that AI-assisted screenings were used in only 0.09% of eye exams during this period, even as traditional methods increased by 185.4%. The majority of patients who received AI-based tests were from the southern US, with nearly half of them being black. The study concluded that while AI owed promise for diabetic retinopathy detection, its adoption with the medical community has been slow. That was the IF News at 10 on IF TV. For more up-to-date news, please visit IF TV on YouTube. Don't forget to like, share, and subscribe our videos. Thanks for watching. I am Angela Oluwafabunmi. Bye for now.
iHealth TV, preventing needless blindness.